Welcome to CANVax's webinar series. Between October 2019 and February 2020, CANVax hosted a series of webinars that explored current and emerging topics in immunization. Due to popular demand and high engagement, we're happy to announce the continuation of CANVax's webinar series through 2020. Our purpose of hosting these webinars is to support and inform the work of public health professionals to improve vaccine acceptance and uptake. To learn more about our upcoming webinars, please visit our website at canvax.ca/CANVax webinar series, as indicated in the link you see on the screen. Before we begin, we would like to acknowledge that CPHA's office is situated on the ancestral and unceded territory of the Algonquin Anishinaabe people. They have been the guardians of this land for millennia, and CPHA is grateful for the example their stewardship provides. CPHA is committed to working with all First Nations, Inuit, and Métis peoples and their government in realizing meaningful truth and reconciliation. CANVax would also like to express our deepest gratitude to all the frontline essential workers dealing with the COVID-19 pandemic. Thank you for all your hard work in keeping us safe during this time. Today's webinar, Vaccinating Pregnant Women, Knowledge, Beliefs, Attitudes, and Practices of Women's Health Care Providers, is brought to you by the Canadian Public Health Association through the CANVax Project and its partners, Immunize Canada, the IWK Health Centre, and the Institut National de Santé Publique du Québec. I'm Antenatal, CANVax Project Officer with CPHA, and I'll be the moderator for this webinar. Assisting me on this webinar is my colleague, Rutan Zhu, who is also a project officer for CANVax. As for a bit of housekeeping, all attendees on Zoom are muted. However, the tool located at the bottom of your screen offers you a few interactive features. For this webinar, the Q&A feature will be used to ask questions. If you have any questions, please type them in the Q&A box. You can also do so at any point during the webinar. Only you, myself, and the presenter can see your questions in the My Questions section, and you as the attendee have the option to submit them anonymously. When asking a question to the presenter, it is first read out loud, answered live by the presenter, and then posted in the All Questions section. Feel free to submit your questions at any point during the presentation by using the Q&A feature. All questions will be answered in sequence at the end of the presentation, and myself and Rutan will be moderating them. If you do have any questions regarding technical difficulties, please ask them in the Q&A box as well, and we'll reply to you. And if multiple people are experiencing the same problem, we'll address it live. We strongly encourage attendee participation and look forward to hearing your thoughts and questions. Finally, just some quick notes. Our webinar is being recorded and will be made available on canvax.ca and on CPHA's YouTube channel a few days after the end of the presentation. Please note that after the end of this webinar, you'll be invited to take a short 5-minute survey. We strongly encourage you take this survey to provide your feedback so that we can assess your satisfaction and identify areas for improvement in the delivery of this webinar. Further, if you haven't already registered with CANVax or subscribed to our newsletter, visit canvax.ca today to do so. So with that, let's begin. I would like to introduce our speaker for today, Dr. Courtney Green. Dr. Green is the Manager of Medical Research and Guidelines at the Society of Obstetricians and Gynecologists of Canada, also known as SOGC. She received her PhD in Neurosciences and MSc in Pharmacology and Toxicology from Queen's University. Since completing these programs, she has worked on a number of large research projects involving collaborators, stakeholders, and partners from across Canada. She was a research associate on the Fetal Alcohol Spectrum Disorder Project for NeuroDevNet, known as Kids Brain Health Network, and worked as the Manager of Research Development at the Canada Fetal Alcohol Spectrum Disorder Research Network. In her current capacity, Dr. Green supports 15 clinical committees and oversees the development of all SOGC clinical practice guidelines. She is integrally involved in a variety of national projects that are aimed at improving knowledge, attitudes, beliefs, and practices around key issues in women's health. Her interests include immunization in pregnancy, substance use across the female lifespan, Lyme and other zoonotic infections, and women's cardiovascular health. So with that, I would like to turn it over to you, Courtney, and you can start sharing your slides.
Perfect. Well, thank you very much for the invitation to present as part of the CANVax webinar series. I'm quite thrilled to speak to you about this project that we were pursuing with support through the Public Health Agency of Canada. I'd also like to acknowledge all of our frontline workers who are working tirelessly to manage the current COVID pandemic. And again, thank you very much for taking time out of your very busy schedules to listen to this webinar. So as you heard, I'll be talking to you a little bit about the work we've done around vaccinating pregnant women, and specifically related to getting a better understanding of knowledge, beliefs, attitudes, and practices of women's healthcare providers. And essentially, based on this information, what we were really wanting to do is develop tools and resources and various strategies to help provide further education and training around this important issue. So just to give a little bit of background and context, as many of you likely know, that in recent years, we've received, or we are paying more attention to vaccination during pregnancy. We're hearing a little bit more about it in the media, and as well, we're learning more about it through our own networks and through perhaps our own obstetrical care providers. We know right now that vaccination against the flu influenza is currently recommended in pregnancy. And NACI, actually just about 2 years ago, recently released recommendations regarding the pertussis vaccination. And they now recommend that women receive this vaccine in every pregnancy. And so again, just giving you a little bit of background and context. So some of the things that we were recognizing, we know that this is an under-immunized and non-immunized population, and we really wanted to know what could we do, and what is the current landscape in Canada among healthcare providers. And essentially what we were really interested in is why are they hesitant, and where are those barriers? So we started our project by doing a fairly comprehensive Canadian scan, environmental scan of the Canadian landscape. And some of the things that emerged in the literature were things around lack of knowledge. So again, this had to do with concerns around vaccine safety, availability, access. So again, some common things that you've probably heard in your own practices. Scope of practice was another one that emerged. Many, especially the obstetrical care providers, felt that vaccination was really outside their scope, and that these particular services should really be overseen and discussed with other primary healthcare providers. They also didn't see vaccination as part of routine antenatal care. And another one that we found was remunerations and incentives. So there weren't a lot of ways in which clinicians could be remunerated to provide this service. There were logistical challenges. So as many of you might know already, there are specific parameters associated with providing vaccines. So dedicated vaccine fridges, the administrative support to ensure that these fridges are maintained, just even a delivery service in terms of accessing these vaccinations. And so just some of these challenges themselves emerged in the literature. Medical legal consequences. So we did observe some reference to, again, and largely based in part to media attention around adverse consequences of vaccines. Some practitioners felt that they weren't really interested in looking at or in providing vaccines due to these potential adverse medical legal outcomes. And then largely what we did find, despite these particular reasons for hesitancy, what we did find was that there were really few studies among Canadian obstetrical healthcare providers, and specifically non-physicians. So we didn't really have a great baseline data set. So this led to the objectives of our project, which were really to determine knowledge, beliefs, attitudes, and current practices of women's healthcare providers related to vaccination during pregnancy. And essentially what we wanted to know is, were there differences specific to the type of professional groups? So were there differences between obstetricians, family physicians, nurses, midwives, and pharmacists? And so the goal was to collect data from these different professional groups. Essentially what we wanted to do is observe and, to analyze and collate this data, and then really use this baseline information to develop targeted training and education tools that would ideally help to improve rates of immunization among pregnant women. And as I've sort of alluded to already, given that we don't have data on this on a national scale, we thought it was really important to collect this baseline data so that in future, if we are able to again conduct our survey, we might be able to identify areas where changes have been made and or where areas still are lagging and require further support. So we did this survey over roughly an 8-month period, and what we did find was there were, not surprisingly, there were some differences around the specific healthcare providers. So what we were finding, again, which is probably not surprising to many of you, is that the family physicians or general practitioners and nurses were the most likely healthcare providers to provide vaccinations to pregnant women. And one of the things that emerged quite clearly in our data set was that more education was needed specifically to the midwife group and the pharmacists. And as well, I should note that our survey was done prior to the recommendation for the pertussis vaccine. And so one of the clear indications that emerged from our survey was a real need for more information and training around the Tdap vaccine. And so, and that really came out very clear. And again, as I said, this was prior to NACI's recommendation, so it wasn't surprising that we saw such low uptake of the Tdap vaccine. And then again, scope of practice. So as I alluded to earlier, a lot of, especially the obstetricians, really felt that vaccination was outside their scope. And we recognized quickly that that was something that we needed to address. So one of the things that we obviously wanted to know is this data set reflective of all obstetrical healthcare providers? And so that is the risk of doing these national surveys. Often you are subject to potential biases, but what we did find was that the data was actually quite encouraging, and we found that most of the individuals who responded indicated a really good baseline knowledge about vaccines, and many felt confident discussing and providing vaccinations to their patients. And so despite this finding, there is still a disconnect because we know that rates among pregnant patients remain low. And so one of the observations we found was that healthcare providers that had the highest volume of pregnant women that they see each week were also the ones who were not providing vaccinations. And so what we felt was that this may be accounting for this large percentage of under and non-immunized pregnant patients. And so again, that might be something that we need to target and think a little bit more about in terms of our education and recognizing where some of the sources of this lack of vaccination are originating from. So basically we did this national survey. We got quite a bit of data. We got the baseline data we wanted. And the next steps really were looking at that data and trying to think, what are things we can do to help our providers, to really help them guide their practice. And so we decided that there were several knowledge translation activities that we thought would be really important. So one was developing a clinical practice guideline. And so we have the benefit of working with a highly skilled and highly skilled and have extreme expertise in reproductive infectious diseases. And so we were able to engage them to develop a clinical practice guideline specific to immunization and pregnancy. As well, we were able to do a number of different workshops and webinars, so specific to immunization and pregnancy. The SRGC hosts 3 regional meetings across Canada each year, and we also have 1 national meeting every June. And so we were able to leverage these existing opportunities where we knew we had a large audience of obstetrical healthcare providers, and we were able to offer these workshops on this very important topic. Another activity that we did was a very comprehensive e-course on vaccination and pregnancy, which consisted of a number of different modules, all covering important areas in regarding providing vaccines in your clinic and starting to actually provide that service. I'll talk a little bit more about each of these later in my slides. And then finally, a toolkit. So we use the word toolkit, but basically what we were referring to is a package of resources that healthcare providers can use to help support vaccination practices in their clinics. And so here's just a picture of the first page of our clinical practice guidelines. So this one is obviously immunization and pregnancy, as I mentioned. And really the take-home messages are the fact that prenatal care providers play a pivotal role in vaccine uptake. So if you go to the literature, if you look at what's out there and you do a little bit of analysis, you find out very quickly that one of the most, if not the most, important indicator of whether or not a woman will actually get a vaccine during pregnancy is a recommendation from a trusted healthcare provider. So these maternity healthcare providers really do have an important role to play in helping to address immunization rates in this population. And again, as I have here in my first take-home message, patients' acceptance is largely based on this strong recommendation. The other thing that we want to make really clear to our patient population is that many of the vaccines that are available are safe during pregnancy, and specifically the flu vaccine and the Tdap, so the pertussis vaccine, are both extremely safe in pregnancy and universally recommended for all pregnant women. I should also maybe do a little segue here very quickly just to address the current situation, given that we're in the midst of a COVID pandemic, and mention that while at this time we're out of sort of the flu season, so women are not necessarily needing a flu vaccine, what practitioners or what we're recommending to obstetrical health care providers is to still give the Tdap vaccine, but perhaps approaching it more on an opportunistic basis. So many antenatal care visits right now, given our situation, are being done virtually, but there are some visits where women do need to come into clinic, and those are the visits in which we can capitalize on that opportunity to provide the Tdap vaccine, as long as it's within the window between 20 to 32 weeks, because that's when we know it has the most impact. Moving on. And we also, as I mentioned, did workshops and webinars, and specifically, we were really fortunate after NACI came out with the recommendation around Tdap, we were able to host a targeted webinar. Actually, it was purposely provided at the same time as NACI's recommendation release, our guideline release, and then simultaneously we were able to offer this webinar on the recommendation, and it was given by one of our experts in infectious disease, Dr. Vanessa Poliquin, and the webinar was available in English and French, and what was really great was we had a facilitated Q&A at the end of it, and so that enabled practitioners to ask questions in real time and get real-time feedback. Similarly, the workshops were also offered at our regional meetings and our national conference. And so the next slide here, I'm just demonstrating or showing you some of the posters that we developed around vaccination and pregnancy. So we adopted the myth versus science, and then we also had the one just reminding everyone, and specifically pregnant women, to get their flu vaccine. And as our guideline was published in our journal, so the Journal of Obstetrics and Gynecology of Canada, we were able to polybag. So we were able to include these posters in all of the mailings of the journal. And so that was actually a really effective mechanism to disseminate this information. These posters are also available on our public health website, so our pregnancyinfo.ca, and we also have them available at our booths and in our conferences. So the next one. So as I mentioned, we worked really hard to develop an accredited vaccination and pregnancy e-course. So as you can see here, there's 8 modules, and essentially they go over all of the things you need to know about developing and setting up a vaccine clinic in your own setting. And this course, we launched it last June during our national conference. And I would like to also just mention to you that at this time, again, to show our support of healthcare providers managing the COVID crisis, we have opened our e-courses, and so they're free of charge right now. So if this is something of interest, I would encourage you to visit our website and access the courses. Normally, our courses do have a nominal fee associated with registration, and that's just to cover our the administrative costs and platform costs. To help promote this particular e-course, we were fortunate to get one of our experts to do a little e-course promo. So I'm just going to play this for you quickly. It's only 40 seconds, I think, just to give you an idea of the types of promotion that we do for this particular activity.
As a caregiver for women who are pregnant, I find that I lack some of the most recent up-to-date information on the benefits and the lack of risk of immunizations in pregnancy. Specifically, we include the influenza vaccination and the Tdap vaccination in later pregnancy. Fortunately, the SOGC has developed an online educational program that does provide me with the information I need to provide adequate information to the pregnant woman about the benefit and the lack of risk to immunizations in pregnancy.
Given by Dr. Bill Eamon, who was one of our family physicians who helped collaborate on the e-course content development. And I'd also like to mention at this time that one of the things that we actually pride ourselves on is our collaborative nature, and to ensure that we are meeting the needs of all the different healthcare providers who support women during pregnancy and or childbearing years. We work very closely with our nurses, our midwives, our family physicians, as well as our obstetricians. And so all of these activities that I'm presenting to you today, we were able to get representatives from each of these groups to ensure that our materials and information were delivered appropriately for those different contexts. So in this slide here, I'm just demonstrating several of the tools that we developed as part of our toolkit. The toolkit itself that is part of the e-course consists of over 25 different tools. In this one here, obviously the poster on the left essentially walks you through all of the steps to starting up your own vaccination clinic. And then the one on the right is just describing some of the adverse reactions that can occur following vaccination in pregnancy. And again, very rare do they happen. Do we see severe reactions? Excuse me. This list is just really going over some of the more common ones as well as the rare ones. So as you can see, the poster is available in French. So I should have mentioned that all of our tools and resources are available in both official languages. This is another sticker actually, so you can print this off and actually stick this on your vaccine fridge, and it's just reminders about keeping your vaccine fridge so that it is maintaining those vaccines at the appropriate storage and handling procedures. And then this other little resource that we developed was is similar to a prescription pad. And so one of the comments that we got was just the time needed to actually provide prescriptions to patients. And so we developed this little piece of paper that physicians can easily print off and check off the vaccine, and then their patients can either, if they don't provide vaccines in their clinic, then they can take their prescriptions to either their family physician, a public health agency, or a pharmacist to ensure that they do receive the vaccine during pregnancy. The next little video I'd like to show you, again, it's not very long. This was a fairly significant social media campaign that we developed. While informative for healthcare providers, it was essentially targeted to the general population. And we were quite fortunate that it was selected as one of the finalists as part of the CIHR video competition. Unfortunately, we didn't win, but we were really proud of this little video, and it did get quite a bit of traction. It was also available in French and English. So I'm just going to play it for you quickly. Like I said, it's only about 1.5 minutes.
Did you know you're supposed to get vaccinated while you're pregnant? I had no idea until recently. I thought I was doing all the right pregnancy things by avoiding alcohol, smoking, using cannabis. I was getting all the tests, eating well, and taking classes. But a few weeks into my pregnancy, when autumn was in full swing, I started really worrying about people coughing and sneezing around me. But a couple of months later, at my 24-week appointment, my doctor asked if I'd like to get my flu shot and a Tdap shot, which I had never heard of. It's for tetanus, diphtheria, and pertussis. I was like, is this safe? And she was like, yes, they're absolutely safe and effective. Pregnant women are at a higher risk for complications from the flu, which I didn't know. Then she explained that newborn babies can't get immunized until they're 2 months old, but they'll be protected for those 2 months if I get immunized while I'm pregnant. Plus, we'll both be protected while I'm pregnant too. I'm so glad I got the shots. I know you care about your health and your baby's well-being too.
And so essentially that particular video, as you can see, it directs you to our website. So a lot of the information that we have developed as part of this project, we have also updated our respective web pages on our pregnancyinfo.ca website. So just to kind of leave you with a few concluding statements and some next steps. So obviously the interdisciplinary approach was really key to our project's success. So as I mentioned, we work closely with midwives, nurses, family physicians, and obstetricians. And we really appreciated the input of all of these different groups. The tools and resources that we developed, we ensured that they could be used for all these different healthcare providers and in all these different settings. We're quite excited by new and ongoing collaborations with a number of different associations and societies, and we'll continue to look at future opportunities to continue our messaging around the safety of vaccination during pregnancy. And then one of the things obviously we would love to see is in future, being able to repeat some of the surveys that we did just to see if there have been changes in the knowledge, beliefs, attitudes, and practices. And again, just to see where we can continue to make improvements. So I'll leave it here with just acknowledging quickly our the support that we received was from Public Health Agency of Canada. A number of people contributed to make this work possible. So the research team at SOGC, researchers at Institut National de Santé Publique de Québec, and then the Canadian Immunization Research Network team. So I will leave it there, and I'm obviously happy to take questions if anyone has any.
All right, thank you so much, Courtney, for your presentation. It was very informative and interactive. Thank you so much for presenting the webinar today. At this point, if any attendees have any questions, please submit them using the Q&A feature. And as a reminder to anyone, if you want to submit your questions anonymously, you can do that. Any questions that we answer live will appear in the Q&A window. So I see that there is one question. An attendee asks, I would like to get a copy of the RX pad to distribute to the maternity ward in our hospital.
That's great. So wonderful. I'm always so pleased to hear that people find our resources useful. So currently, I'm just trying to think what the easiest way. Either I'm happy to just email you if you want to send me a quick email, I can email it to you. Otherwise, it is available through our online course. And it's just a case of navigating to the sogc.org website, and then what you can do is go to our online courses, and then it's just called Vaccination and Pregnancy. But again, if that's complicated, if you want to email me, I'm happy to send that to you. Is that the easiest, Antonella? Do you want to share my email address?
Sure. If you're willing to share your email address, we can send that in our post-webinar email.
Okay, so what I'll do is I'll send you an email. We have a research email address. It's just research@sogc.com. And if you want to send I'll share it with you after, just so you have it written down. And then any questions or any comments, people are welcome to contact me through that website.
Awesome. And the same attendee also said, yes, email will work. So that's great.
Oh, that's wonderful. Okay, perfect.
Yeah, and another attendee asked, is it formatted to, so is it able to,
is it appropriate for midwives? Sorry,
yeah, is it appropriate for midwives?
Well, yeah. we definitely tried to. So we had a midwife on all of the, sorry, I should start. all of the activities that we did, we had midwifery representation. So my feeling would be is that a lot of the resources would be available and applicable to the midwifery context. Now, I guess it would have to be tailored to your own practice based on how you work and where you work. But certainly we did our best to ensure that it was appropriate for those contexts as well.
All right, awesome. So I don't see any questions at the moment. So I'm just gonna give some time for people to ask a question. However, in the meantime, Courtney, I actually have a question for you. Could you tell us more about what it's like working with midwives and pharmacists on developing clinical practice guidelines, and what are some of these challenges in improving vaccination rates?
So certainly, I would say, so the first part of your question, so collaborating with the different groups, I would say it can be a challenge because sometimes there's different contexts, and certainly with vaccination provision, that's going to come back to scope of practice, and it does differ across Canada. So one of the big challenges we have is that instead of a national health delivery or healthcare system, healthcare is delivered provincially and territorially. And so that means that each province and territory is responsible for their own funding and how they deliver these types of services. So right away, you do have some systemic challenges. Now, what I would say is that essentially, when we're developing guidelines, we go to the literature. And so we want to make sure that everything is evidence-based. And so despite sort of the differences across systems, we are all making the same recommendations. And then in turn, those recommendations can be taken back to those respective bodies who can potentially lobby for changes at those levels of government. So it's a bit of a long-winded answer. I think, you know, we really do try to work closely. I think it doesn't help anybody to develop guidelines or recommendations that are inconsistent across national healthcare bodies. And so I really do feel that, you know, despite any challenges that might arise, I think it's really important that you sort of address them head on and do obtain some consensus. So with our clinical practice guidelines, I will say that we have an extremely rigorous process. So while we have authors that essentially draft them and review the literature, they're overseen by committees, and then we have other external reviewers, and then ultimately they do go to our board. So we do have a fairly rigorous process in place with respect to with our guideline development. And then again, like I said, that I think it really does provide a stronger product when you have input from all of those different stakeholders. I'm not sure. Did I answer your question?
Yeah, no, absolutely. I just was interested in hearing more about the development. So I'm just looking, and we don't have any other new questions and answers, but I also do have another question for you, Courtney.
Please, yes.
So I know as things are developing very rapidly with the COVID crisis, you mentioned that vaccinations for pregnant women are kind of happening on an opportunistic basis for when they're able to have in-person visits. So I'm just wondering, you presented quite a few like amazing posters and toolkits for vaccination and pregnancy, and I was wondering if SOGC has given some thought to create some communication materials on maintaining vaccination during COVID-19 or a pandemic. I know everything's really new right now, but I'm just wondering if there's anything that's coming up or if that's possible.
You know, I'll say, unfortunately, not specific to immunization. So obviously, I mean, we all know there's no vaccine for COVID. I mean, hopefully we'll see something. I think everyone's fingers and toes are crossed. I mean, in terms of management right now, given the COVID context, so I guess we don't have anything specific around maintaining the vaccination pieces, aside from what I already mentioned about the fact that we're still advising the Tdap vaccine, and that as long as you administer, or the recommendation is to administer between the 20 to 32 week window, is still advisable when women may be coming in person to clinic for other reasons. You take advantage of that opportunity and give them their vaccine. So we don't have anything beyond that. You know, things may change depending on how the pandemic rolls out. If we are still experiencing the situation when flu season crops up again, then I could see us doing some more, just reminding people to get their flu vaccine. Obviously the flu vaccine won't protect you from COVID, but it will help keep you safe from the flu. And in turn, that will help keep you out of hospitals and again, using those resources. So what we do have instead is a dedicated resource page on our website about COVID management and pregnancy in general. And what we've been doing is we've been populating that with resources we receive from other groups, as well as other guidelines.
Okay, great. Thanks for that.
Mm-hmm.
We're running pretty early on the webinar, which is always good to run on time or early. So I don't see any questions coming up at the moment, but I do strongly encourage, if you have any questions for Courtney, we have plenty of time to answer them. So I'm just going to give a couple of minutes and see if anybody has any more questions they'd like to ask. All right, so seeing that there's not any questions, and people are very busy with everything that's happening right now, that does conclude the end of our webinar. So if you do have any questions for Courtney after this webinar, please contact CANVax, us, on our contact page, and we'd be happy to connect you with her. Also, if you do have any questions for CANVax about COVID-19 and vaccination, also feel free to contact us as well. Overall, thank you so much for joining us on our webinar, and thank you again, Courtney, for your wonderful presentation. As a quick reminder, please don't forget to fill out our survey upon closing the webinar window on your device. We really look forward to your feedback so that we can make improvements based on your suggestions. And as a reminder, the webinar, there will be a recording of the webinar. We'll have it out within a couple of days after this presentation, so it will be available. Other than that, thank you so much. Thank you, Courtney. And thank you everybody for attending, and have a wonderful afternoon and stay safe.
Okay. Well, thanks so much. Take care. Thank you.